Med History.
Progeria. Perhaps this is one of the rarest and most terrible genetic diseases. Progeria can manifest itself both in childhood and in adulthood, and in both cases, it will be associated with a gene mutation. Premature aging disease is an example of how a 13-year-old teenager can look like a 70-year-old grandfather. Scientists from all over the world claim that since the discovery of the ill-fated disease, people on average live only 13 years. No more than 80 cases of progeria diagnosis have been registered worldwide, but some experts continue to claim that it is curable. However, no one wants to say how many progeria patients have lived to a happy moment. The term progeria in translation from ancient Greek means premature aging. The childhood form of progeria is called Hutchinson-Gilford syndrome, according to the surnames of the researchers who independently described this pathology for the first time: the British doctor J. Hutchinson in 1889, his compatriot H. Gilford in 1897. The adult form is called Werner syndrome, since in 1904 the German doctor O. Werner was the first to officially observe the symptoms of aging in adolescents aged 14, 19 years. Both variants of the disease are extremely rare. The prevalence of pediatric progeria is 1 case per 7. 8 million people since the beginning of pathology studies, about 150 sick children, have been identified. Adult progeria is more common. The average epidemiological indicators are 1 patient per 100,000 population. Causes of progeria. The disease is based on a genetic mutation. The cause of the childhood type of progeria is a defect in the LMNA gene, which encodes a special protein lamin A, which builds the shell of the cell nucleus. As a rule, mutation occurs sporadically, during the maturation of germ cells in parents or at conception. However, researchers have identified several cases of pathology in siblings, some of whom belong to families with closely related marriages. This indicates the possibility of inheriting an autosomal recessive mutation. Parents are carriers of the defective gene, but do not get sick and are capable of procreation. Adult progeria is a hereditary disease. It develops in the presence of a defect in the RECOL2 gene, which is responsible for the production of the WRN protein, which supports the stability of the genome, the integrity and structure of DNA. The mutation is transmitted in an autosomal recessive manner. The disease manifests itself in people who have received 2 defective genes in the same allele, from the mother and from the father. Symptoms of progeria/. Hutchinson's progeria makes its debut after a period of normal development between the ages of 6 months and 2 years. The appearance of children changes. Growth slows down, the size of the skull increases, but the front part remains small. The lower jaw is underdeveloped. A beak-shaped thin nose and exophthalmos, bulging eyes, are formed. Hair falls out completely, on the head and body, eyelashes and eyebrows. With alopecia, the hair follicles are destroyed, so further hair growth becomes impossible. Veins bulge out on the scalp. The dermis and subcutaneous tissue undergo atrophic changes. The skin is thinning, drying out, and covered with wrinkles. Lipodystrophy develops, a noticeable decrease in the amount of subcutaneous fat. It remains relatively intact on the cheeks and pubis. Scleroderma-like lesions form on the trunk, seals in the lower abdomen, buttocks and thighs. Pigmented spots appear on exposed areas of the skin. The nails are underdeveloped, brittle, thickened, roundly convex. They have the shape of watch glasses. By the age of 2, fibrosis of organs and periarticular tissues develops. Passive movements in the elbow and knee joints are limited, contractures. A characteristic position of the leg bones is formed, the rider's pose. The skeleton undergoes hypoplasia, dysplasia, and degenerative changes. Milk and permanent teeth erupt late, are partially absent, crowded, curved, and prone to caries. By the age of 5, 6, vascular atherosclerosis, heart murmurs, left ventricular hypertrophy, clouding of the lens, and insulin resistance are diagnosed. The genitals remain underdeveloped. The level of mental development is usually higher than that of peers. Clinical manifestations of Werner syndrome are detected from the age of 14 to 18. The teenager begins to lag behind in growth, his hair turns gray and falls out. By the age of 20, patients go bald. The skin of the face and limbs pales, thins, and stretches. A network of blood vessels is visible below it. Muscle and adipose tissues atrophy, arms and legs become disproportionately thin, and the skin over the articular protrusions ulcerates. By the age of 30, cataracts appear, the voice weakens and wheezes, ulcers form on the feet, calluses, vascular asterisks, keratosis on the soles. The appearance of patients is specific: low height, moon-shaped face, protruding chin, narrowed. The sebaceous and sweat glands atrophy. Bone and joint changes include metastatic calcification, generalized osteoporosis, erosive osteoarthritis, limited mobility and deformity of the fingers, flexor contractures, pain in the extremities, arthritis, and osteomyelitis. Atherosclerotic vascular changes are noted, cataracts slowly progress, and intellectual abilities decrease. After the age of 30, endocrine diseases manifest themselves: diabetes mellitus, hypogonadism, thyropathies. 5–10% of patients have malignant tumors of various organs, bones, and skin. The cause of death is oncopathology or severe cardiovascular disease. Treatment of progeria. Specific methods of progeria therapy have not been developed. Medical care for patients is to alleviate the symptoms of the disease. Atherosclerosis, osteoporosis, osteomyelitis, cataracts, diabetes, heart pathologies, and oncological diseases are being treated. There is a known case when the patient's condition improved markedly for several years after a heart transplant operation. Scientific research is being conducted in the field of genetic engineering. Attempts are being made to isolate a mutated gene from DNA and replace it with a healthy one. In parallel, a method of idiotropic therapy is being developed. Scientists from Sweden have found a way to neutralize defective lamin A molecules that penetrate the membrane of cell nuclei and contribute to cell death. Positive results were obtained in experiments with rat muscle tissue. The drug has not yet been tested on humans. In the USA, since 2012, the effectiveness of the use of a farnesyltransferase inhibitor, a drug developed for the treatment of cancer, has been studied. After therapy, the children from the experimental group felt better. Arterial stiffness and elasticity increased, bone density decreased, cases of transient ischemic attacks, cardiac pathologies, loss of vision and hearing decreased. Life expectancy increased by 1.6 years. Prognosis and prevention. On average, patients with childhood progeria live up to 13 years old. Deaths have been reported at 7 and 27 years old. Life expectancy in the adult type of the disease is 30–40 years. The cause of death is atherosclerotic complications and malignant neoplasms. There are no preventive measures. It is possible to prevent the birth of a sick child with the hereditary nature of the disease, with Werner syndrome, in some cases Hutchinson syndrome. When the pathology is detected in the family, future parents are classified as a high-risk group. Such couples are assigned medical and genetic counseling. Progeria, or accelerated aging syndrome, is a rare genetic disease characterized by an accelerated aging process in children. Children suffering from progeria have the appearance of an elderly person with all the relevant age-related changes, such as abundant wrinkles, hair loss, and heart problems. Progeria is an incurable disease, and patients with this diagnosis usually do not live to adulthood. However, research in the field of gene therapy and other medical technologies can help in developing ways to improve the quality of life of patients with progeria.